October 4th, 2024. And item number 1, call to order and roll call. Valerie, if you would, just to confirm that we have a quorum.
Absolutely. Chair Fergus Lothridge.
Present.
Brooke O'Byrne is excused. Senator Pete Goycochea. Dr. Erica Rist.
Present.
Matt Walker.
Here.
Amanda Osborne is excused. Chris McCann.
Present.
Awesome. Thanks, Chris. Patrick Rogers.
Present.
Sarah Dearborn.
I'm here, but I do need to leave at 1:30. I'm sorry.
Okay, we'll try to get through as quickly as possible. And we should have quorum. We had one more board member jump on, so we should have quorum without you two. Bryce Shields. And Jerry Sanders.
Present.
Awesome. That is 7 more board members in attendance. Chair Lothridge, we do have quorum.
Okay, let's get moving right along. The next will be public comment. If public would like to make comment, please indicate so, or you may dial in at 408-638-0968 or 669-900-6833. And when prompted, passcode is 292550. Limit to 3 minutes. And if you could, we'll also have another section of public comment. We do have some board members that need to drop off. We have a couple action items that we would like to get to, if that would be allowable. Any public comment at this time? Hearing and seeing none, we'll move right into number 3, which is a action item review and approval of the meeting minutes from August 2nd, which were August 2nd, 2024, which were emailed to board members by Valerie. Any questions? Entertain a motion to accept.
It's Matt. I'll make a motion.
Motion by Matt
Chris McCann.
and Chris.
Chris McCann, I'll second.
Okay, all those in favor, say aye. Aye.
Aye.
Any opposed? Okay, thank you. Item number 4, moving this right along. This will be action again for the board members. Approval of letters of support from the Rural Regional Behavioral Health Policy Board. And Valerie has a number of these that she's been coordinating. So Valerie, I'll let you run with this one.
Okay, thank you so much. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator, also listed here is the Rural RBHC. So I reached out to many of our community stakeholders and just said, hey, are there any letters of support that you could utilize for applying for grants? So we did get some really great feedback on some different projects. We do not have draft letters drawn up. So the action here would be to approve putting together a letter of support based on the project that the individual is going to be applying for on behalf of the board. We have several folks here today. One of the main projects that we have several folks applying for is the State Opioid Response Grant. Laura Oslin from PACE Coalition. We also have, I believe there's somebody from Frontier Community Coalition on the line to speak to that as well, and be here Nevada. So checking with them, it sounds like there's no overlap or necessarily competition amongst these different applications. So it's not that we would be submitting letters of support for projects that are in competition for one another. That being said, I'm going to turn it over to the first person on my list, Laura Osland, to describe what she's applying for with the grant funding from the State Opioid Response Grant. Laura?
Thank you very much. Part of what I am applying for is what we tried for the Funds for Resilient Nevada. And so it is to bring in-person and webinar trainings, provide information and research on alternative care options for pain management. There are some of your board members that I will be working with individually on this also, because I want to bring services into Eureka County and White Pine County, and Matt Walker and I have collaborated on other grants, and Jerry and I have collaborated on it. And so part of this is to bring the recovery, the smart recovery that we spent all the time and effort getting people trained on, and then the funding was not renewed to actually implement it. So we're looking at smart recovery. We're looking at some harm reduction, being the drug take backs, the safe disposal. So that would be like the deterra bags, and the safe storage, which we have lock boxes, et cetera, that we provide to families who may end up taking young children in. So if grandparents become foster to their grandchildren, or just foster families who the foster families are on medication and they're taking in young people. Along with Matt Walker, we were talking about being able to bring in trainings, whether they're in person or webinar, for some of our first responders and some of our doctors and medical providers, to have a better understanding of again, the pain management and safe disposal, and just a better understanding of the and not results, what happens with the opioid overdoses, and keeping families safe, and also to bring in trainings to the school districts, law enforcement, and other agencies and organizations addressing SUD, and to be able to send people to trainings such as the RX Summit that they might not have funding for through their agencies and organizations. And that's enough babbling. Thank you.
Thank you, Laura. Do any of the board members have any questions for Laura? Okay, hearing and seeing none. So what I'd like to do is actually kind of batch approval if we can towards the end. So if there's anyone from Frontier Community Coalition on the line to speak to that grant application, if you could go ahead and please state your name for the record and give us a brief description of what you will be applying for with the State Opioid Response Grant. All right, clicking through, I am hearing and seeing none. So we will move on to,
Hello.
oh, yes, hello.
Sorry, I was just taking a pause to see if anyone else spoke up. My name is Jill Mannett. I'm with Be Here, Nevada. And I am here on behalf of our executive director, Dr. Sarah Hunt. And just wanting to state that we're seeking a letter of support for our application. We are really approaching this application from a workforce development perspective. And Valerie, I think Dr. Hunt has already spoken to you about this as well.
A little bit, but but if there's any detail that you could give to the board, since it's the board who's going to be voting on it, that would be fantastic.
Okay, if I could speak back up in just a minute, I'm getting that additional detail, and then I can circle back around. I apologize for that, but I'm getting that right now.
Okay.
One moment here. And while I'm getting that detail, maybe I can just quickly remind the board that Be Here Nevada is the result of AB 37 that was passed last year. We've just hit our 1-year anniversary. And this was one of the policy proposals that came forward from this board last year to establish the Behavioral Health Workforce Development Center. And so we've been spending this last year getting our activities up and running. And one of them has been that we were awarded the ARPA Nevada Workforce Grant, and it has recently awarded 12 scholarships to students across UNR and UNLV in the various behavioral health training programs. And so again, we're just looking forward to expanding those efforts to continue to develop that workforce from the opioid perspective. So, and I apologize, I'm going to get those details. And if you want to move on, I can speak back up when I have those details.
Perfect, Jill, that would be great. We do have another speaker. And then we
great.
also do have a spot on our agenda for you to speak to the progress of Be Here and Be as
Perfect.
well.
Thank you very much.
Okay, no problem. So Pauline Saw, Director of Humboldt County Juvenile Services and also board member of Humboldt Connections, is also on the line, and she's going to speak to the projects that those organizations will be applying for.
Thank you, Valerie. For the record, Pauline Sala. I'm actually going to ask if I can be put on a future agenda because I don't have the exact information on the funding source. It's actually due in December.
Okay.
So can I be placed on the next agenda? I think it was November, you said, Valerie?
Yeah, so the next meeting, I believe, is November 1st, if I'm correct. It's the first Friday of November. So if you would prefer that, we can do that for sure.
Yeah, if we could do that, I would appreciate it. That way I'll have more direct information. I mean, we know what programming we're going to apply for, but I'd like to have all the details when I come before your board.
Okay, perfect. Thank you so much.
Thank you.
No problem. Jill, are you ready?
I think we might have to wait. If you're looking for more detail beyond what I've provided, I apologize. Valerie, I think they were sending you that material. But if it needs to be moved, I think we might need to do that.
Okay, I know that application date is coming up soon.
It is October 15th that it's due.
Yeah, Fergus, what would you like to do there? Because I know that, you know, Be Here and Be is something that the board launched. So what are your thoughts?
I would entertain a motion, and I'll phrase it this way, that the board approve the this item and all of the letters of support from the Rural Regional Behavioral Health Policy Board after they've been screened by Valerie and myself to assure that there are no duplication of services and that we meet the needs of our rural region.
I love that.
And I did get one more statement, if it is any help. It's funding opportunities to increase the number of addiction counselors, internship sites, and access to licensure. And that access to licensure really comes from some feedback that we've received that both the cost of licensure, the preparation of licensure has been a barrier to a lot of people seeking out their license and finishing out their training programs. So that's kind of the in a nutshell of our proposal.
So I'll make that motion as I stated there, if I can get a second for that.
Yeah, this is Matt.
This along because we're going to lose some people here.
Yep, I'll second. This is Matt.
Thanks, Matt. Any opposed? Hearing none, passes unanimously with the caveat that Valerie and I will be reviewing these to make sure that and then maybe contact the board members as needed, and we'll have a report hopefully for you next month. Valerie, any other action you need on that agenda item number 4?
Nope, and I think that is our only action item.
That is our only action item. The rest are informational items. So Valerie.
I'm sorry, Fergus, this is Laura.
Yes, Laura.
What would you like to do? What would you like us to do as the requester, do you want us to put together a sample letter? Do you want, I mean, Valerie has plenty that we've used before on other grants, but tell us
Yeah,
what
if
you would
if
like
you
us
had
to
a-
do
if
for
had a
you to
sample
get the letter.
If you had a sample letter that you could forward to us, and that goes for all of the presenters, and a synopsis of what it is you're going to do or propose to do, and the areas that you're going to impact if the funding is approved.
That sounds good. Thank you.
That way we can write a good, concise letter of support for you addressing those key points.
Yeah, always works better than just a general one. Thank you.
Okay, any other questions on item number 4 before we move on? Okay, Valerie, you want to go 5 or you want to go 6? What, is there any preference?
Let's go with 5.
All right, 5 for the concise updates regarding the bill drafts that we know of today, known to affect the behavioral health. Just so you can get this on your radar screen. Again, these are just bill draft requests that are currently filed. And again, Legislative Council Bureau will do their magic wisdom between now and opening bell of the session. Valerie, go ahead.
All right, thank you. Again, for the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. So there's a list of BDRs that we know will be affecting behavioral health, either directly or indirectly. However, if for those of you who do have experience kind of keeping an eye on BDRs as they roll out, they are just listed with like a title, and you can't see any detail really about what the BDR is about until they are assigned a bill number. So there's a little bit of footwork going on here, just kind of clarify and make sure that we're not playing too much telephone. The Rural Regional Behavioral Health Policy Board's BDR does now have a number. It is BDR 54-403. The title is Revises Provisions Related to Behavioral Health. Nice and general. And what this is, again, is entering in the Nevada Board of Examiners for Social Workers into the interstate licensure for social work. And then also revising some of the language related to data, annual data reporting for by the licensing boards. That may or may not need to change depending on what happens with another bill from Joint Interim HHS, which we'll talk about in a minute. BDR S-405 requires a study of mental and behavioral health care parity in Nevada, is from the Washoe Board. This came from a lot of the questions regarding payer parity for behavioral health services and whether or not what we have in place in statute is actually working or not. There have been bills passed in prior sessions that required payment parity for behavioral health services on the part of insurance companies for the persons utilizing them. However, we've all been hearing that there's still some big discrepancies. So what they're doing is they're proposing a study to really dig into what the specific issues are before they start changing statute again, just so that any statutory changes can be very concise and actually adjust and fix the problem. BDR 39-434 revises provisions relating to peer recovery support services, is from the Northern Regional Behavioral Health Policy Board. So what this does is it changes some language regarding peer recovery support specialists, which is PRSS. It adds transition age youth to a pool of people who can be possible peer recovery support specialist interns. And transition age youth are those that are in that age group that would, it's like 18 or 19 through, I want to say 25 or 21. So what many folks may consider college age, and giving them some more opportunities as interns. Then they can be supervised by peer recovery support specialists, supervisors. And there is a specific certification to be a supervisor. Another piece of that bill is to create a workforce pool for peer recovery support specialists and certified prevention specialists. Many of our prevention coalitions have been asked to have their staff trained as certified certified prevention specialists. However, there's currently no mechanism and not really a lot of places where they can actually build that into our workforce. So it'll be interesting to see how that language shakes down and what that looks like once the bill is numbered and published. BDR 39-368 revises provisions relating to providers of non-emergency secure behavioral health transport services. I believe Mark Funkhauser, my counterpart from the Southern Regional Behavioral Health Policy Board, is here. So I'm just going to note the quick things I have here, and then he can jump in and provide any additional detail if necessary. So what I have regarding that bill is that it'll pay for essentially quote unquote deadhead miles for non-emergency secure behavioral health transport providers statewide. Those deadhead miles is when they are returning to their station and not in active transport. So that does help kind of improve the feasibility of operating such programs. We've had several providers who have tried to come into the state and operate non-emergency behavioral health transport and haven't been able to make it pencil because of the difference in costs related to doing business in Nevada and the lower Medicaid reimbursement rates than other states. Another piece here is to pay for rate increase of at least 10% statewide for non-emergency secure behavioral health transports with a 5% incentive bump for trips to recipients in rural or remote areas. So Mark, if you are still on the line, would you like to state your name for the record and provide any other detail?
Thank you, Valerie. Yeah, you captured it. That's pretty much the gist of it. It's mostly Medicaid reimbursement. Yeah, I think the existing statute is not really being utilized even by in-state vendors because of some of the restrictions. And we thought maybe this would give them more incentive to apply to, provide that transportation. So.
Thank you, Mark. Much appreciated. So if you have any questions about that bill or that BDR, please reach out to Mark Funkhauser, mark@nrh.org for further information. All right, moving on to our next one on the list, we have BDR 31-433 revises provisions relating to state financial administration from the Clark Regional Behavioral Health Policy Board. I just wanted to note that I did try to do a synopsis of these bills and others at the Surge Committee meeting last month. However, I did get my description of this BDR incorrect. And so I would like to make a public correction that really the focus of this BDR is enacting prompt payment legislation. And so what this is going to do is require state agencies to pay on a subaward within 30 days. And this is modeled after legislation from Maryland. This comes from some difficulties that some state agencies had in previous grant cycles in getting subawards out to subawardees in a timely manner, sometimes 7-8 months behind. So while they have made huge strides in improving that and making sure that doesn't happen again, this bill would just put that in legislation so that it's definitely more of a hard thing that has to be followed. BDR 129 revises provisions governing healthcare. This is sponsored by Assemblyman Hafen and Senator Titus, and this is what the bill that will be entering the MFT and CPC board into the counseling compact, which is that interstate licensure compact for clinical professional counselors. BDR 352 revises provisions relating to social work, and this is from the Joint Interim Standing Committee on Health and Human Services. And what this would do would be to create a social work apprenticeship program within the Board of Examiners for Social Workers, or BISO. BDR 4353 makes revisions relating to health professions from the Joint Interim Standing Committee on Health and Human Services. This would establish the State Office of Healthcare Workforce and Licensing within DPBH and includes that Behavioral Health Licensing Board, which would consolidate the 4 licensing boards that we have traditionally worked with. So that would be the Board of Psychological Examiners for psychologists, the MFT CPC board, the Social Work Board, as well as the Drug and Alcohol Board. And then the bill would also allow the office to examine consolidation of other licensing boards throughout the interim. So the initial change as it was presented in the Joint Interim Standing Committee meeting on Health and Human Services on August 12th really just kind of focuses on that piece. BDR 358 creates the Office of Children's Mental and Behavioral Health from the Joint Interim Standing Committee on Health and Human Services. The purpose here is to create the Office of Children's Mental and Behavioral Health in Director's Office of DHHS. And what they want to do, from what I can put together, is to really make sure that everything's tied together and break down a lot of the existing silos. This would be expensive. So I have this in quotes because I pulled this directly from the document, the work session document from the interim HHS meeting on August 12th. It would make an appropriation totaling $1,113,364 from the State General Fund to DHHS over the 2025 through 2027 biennium for the personnel and operating costs of the office created in the department, and would make an additional appropriation of $15,000 for equipment and office supplies. BDR 54-449 revises provisions relating to certain providers of healthcare from the Patient Protection Commission. And this one will really enter in a lot of different licensing boards into interstate licensure compacts. The one that has the most behavioral health impact would be the nursing compact. We do have nursing licensure types that work within behavioral health. And so that may help improve some ability to get more nurses here. And finally, BDR 38-451 revises provisions relating to graduate medical education from the Patient Protection Commission again. This would establish a new Medicaid healthcare workforce fund at the Division of Healthcare Financing and Policy to support efforts to expand the state's healthcare workforce, which would include eligible graduate medical education programs, eligible indirect medical education programs, provider fellowship and apprenticeship programs, and loan repayment programs. I listed this and included it because frequently psychiatrists are also included in these programs, and sometimes so are psychologists. So hopefully this will give us an opportunity to build our pool of psychologists and psychiatrists across the state. I do want to note that there are currently no known BDRs that relate to behavioral health regionalization, the creation of local behavioral health authorities, or sunsetting of the regional behavioral health policy boards. There was a rumor going around that there would be a bill that would sunset the policy boards. I did figure out where that came from. Apparently there was discussion and possible proposal of such a BDR from interim HHS earlier in the pre-legislative work. However, that was not brought to interim HHS for their work session. And so as far as we know, that concept has been thrown out, at least for the time being. I will continue to monitor to see if that rears its head again. Does anybody have any questions on these BDRs?
Hearing no questions, I'll just make a couple of comments, or one comment mainly is to Valerie for your hard work in tracking this and keeping us informed, but also for your work in reaching out to legislators to inquire about the said rumor of sunsetting the policy boards. And I think that may have had an impact on that in speaking with Chair Deontay regarding that. So I thank you for the attention to detail on that.
Absolutely. All of these boards have done some really great work, and you guys have really shown through as a policy board that has made some important changes. So I want to make sure that that is appreciated.
Okay. Any other questions on item number 5? Hearing none, we'll move on to number 6. Jill, are you ready to give us a brief update regarding the outcomes of our Assembly Bill 57 from the 2023 session and the development of the Be Here Nevada?
Yes, thank you very much. And again, I'm Jill Mannett with Be Here Nevada, and I appreciate your patience earlier in the agenda today. So yes, the update is that we are 1 year into our project. We are almost fully staffed. We have a couple positions open. We are finishing up the hiring of another position. But we have 4 people currently and a graduate assistant that works with us. We are in the process of finalizing a strategic plan, and within that plan, we have identified specific initiatives that are mapped back to the original bill, so that we can clearly demonstrate our efforts for each of the items within the bill. And so then to just summarize, on the recruitment side, you might recall in the bill there was some emphasis on the K through 12 presence. And that's a piece that I'm currently overseeing. And we've identified in the state that the career and technical education programs within the state are a good avenue for us to tap into for introducing behavioral health careers and working with students to establish some goals, some real tangible goals. Currently in our state, there are 3 human and social services CTE programs. And so we are working actively with one in Washoe County. We're getting a second one in Washoe County up and running, and we've established a new partnership with the third one in Clark County. The goal with those programs is to create something that can be replicated and hopefully expanded across the state. We are also partnering with the AHECs in our state, High Sierra AHEC and Frontier AHEC specifically, and working with the youth programming that they have to integrate behavioral health services into their programming. And at the end of this month, I'll be doing a trip through Northeast rural Nevada, hitting about 6 communities, their high school career fairs. So really trying to get out into the communities and establish those relationships. And in Elko, I'll be meeting with their CTE coordinator as well to talk about how to integrate into the Elko County school system. So we're hoping to just replicate and expand across the state on that level. As I mentioned earlier, we also received the ARPA grant, which awarded 12 scholarships to students in social work, marriage and family counseling, clinical mental health at UNR and UNLV. And those students have also been paired with a community mentor that will work with them throughout their training and also after their training. And then we're also working with UNR on a training that is targeted to MFTs and CPCs to become approved supervisors, which ultimately then we're looking to have that increase the number of internship opportunities available, especially in the rural and underserved areas. That's a brief summary. I'm happy to answer any questions.
Any questions from the board? Not hearing any. Okay. Thank you, Joe, for the brief summary and the good work down there. And keep us posted.
Yes, thank you. And if you aren't subscribed yet to our newsletter, I encourage you to do so. It's available off our website.
Okay. And then we'll go to item number 7, which is Valerie's update on her activities, so our board members know what's occurring around the region in case they're asked or hear something. Valerie can give you the details. Valerie?
Also known as what kind of mischief has Valerie been getting into? For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. So just kind of at a glance, coming to the task forces. So we've got the primary stakeholders from the Humboldt County Behavioral Health Task Force engaged in CIT planning projects. So kind of sitting back and focusing on that a little bit more at the moment. For Elko County, I do need to re-identify some special topic speakers to get for the subcommittees and then get those launched and then wrap back around to the full behavioral health task force. So that isn't gone. It's just had to take a little bit of a back burner due to other projects. Something that may be coming down the line is the creation of a regional or maybe all rural county detention behavioral health task force to assist like communications amongst these law enforcement agencies and criminal justice systems regarding what works, what isn't working, programs, questions, etc. So Sherilyn and I have had the opportunity to work with Nevada Sheriffs and Chiefs Association, as well as Pool Pact's Dog Detention Administrators Working Group. group on some specific things and work through some issues. So we may tap into that. I just need to make sure that it wouldn't be reinventing the wheel. Travel training and presentation. So I just travel specifically. I did have the opportunity to go to Indianapolis at the end of August for CIT International, and I'll talk a little bit about lessons learned there. I also in September went to Reno on September 19th and 20th to co-train assist at Nevada Urban Indians. It was a nice packed house. I think we had 20 to 21 people complete, which is about the perfect size for that size training with four trainers. And it was a really great mix. Something that came out of that is there's definitely a need for more training targeted specifically for Indigenous communities that is also maybe tailored to cultural norms. Videos with not just white people in it would be great. And that sort of thing. So that's something that we definitely gave feedback to Living Works, which is the company that owns Assist and Safe Talk on. They do have Safe Talk programs that are tailored for Indigenous communities. Since Living Works is based out of Canada, those are also really more kind of tailored towards Canadian tribal nations. Upcoming, I will be in Winnemucca for a week in November for the CIT training. And then the only other major travel I have on the calendar at this moment is going to Nashville in April for the RX and Illicit Drug Summit. That is the conference that Laura Oslin mentioned earlier that will be included in her application for the SOAR grant. This is not with those funds. This is through my funding that I get from OD2A. But that being said, if anyone is interested in going to that conference, it is incredibly educational. It is packed with amazing content. I would highly recommend it. And they've put it together in a platform that makes it really easy to go back and get content after each session, as well as check out the content from sessions that you were not maybe able to attend, since there are usually about, I want to say like 20 different sessions going on at any one time. Moving on to CIT Most and Fast. So as I previously mentioned, we did have a meeting with DPBH administrators such as Cody Finney, Lakes Crossing Administration, and other representatives from law enforcement across the state regarding some of the issues that they were experiencing in getting folks into Lakes Crossing in a timely manner. What came from that is it was discovered that the reason why there was a discrepancy in the waitlist times between what Lakes Crossing is seeing and what law enforcement is seeing is largely because law enforcement is thinking of, okay, as soon as we get this person here, that's when their clock starts. Whereas there's a couple of different assessments that do have to take place before a person can be officially added to the waiting list for Lakes Crossing. And if the court systems don't file those documents in a timely manner, that backs things up quite a bit. So any sort of hiccups in staffing issues or processes that the courts are having does affect that. And so what we discovered is that we really need to sit down with the courts and have some conversations with them about making sure that that's done in a way that can help get folks to those forensic facilities and hopefully restored to competency to so they can go to trial. From CIT International, some ideas that came from that. So obviously it's 5 or 6 days of programming. So there was a lot of different things, but some of the things that came out as general themes. One would be a CIT or most programming specifically for our Indigenous communities. And looking at tribal police work, what they have, and when they're working within their communities, because there are some jurisdictional issues, we need to kind of hammer some of that stuff out probably before launching that. But I think it would be something incredibly useful that a lot of our tribal communities are hungry for, just based on some of the conversations that I've had with some folks at the Assist training, as well as at the CIT International Conference. Another one was a CIT Project Echo. Now, if you're familiar with Project Echo, the main purpose of that is to provide continuing education and support for physical health providers, even in different specialties, regarding specific issues that they may encounter. And this is specifically for providers in rural counties. Nevada's Project Echo is run through the UNR Med's Office of Statewide Initiatives under Dr. John Packham's shop. So this would be a CIT version of this that would really provide the opportunity for continuing education, maybe some recertification, and then also question and answer with subject matter experts when it comes to specific issues in crisis response for law enforcement. So that's something that I've thrown out to Nevada Sheriffs and Chiefs Association and some of my law enforcement leaders, as well as my counterparts, is, hey, is anyone doing this? So we found some folks who have applied for grants that would create some continuing education opportunities, and specifically surrounding officer wellness, but that also looks more like connection to providers and paying for clinical services than anything else. I'm gonna have to go stop my video here in a second. Let's see. And then another one would be to pursue CIT training programs from program certification from CIT International. And that's something that I'm looking into for this upcoming CIT training in Winnemucca. Planning is, speaking of which, planning is underway for a CIT training in Winnemucca that week in November. We will be piloting that CIT International and BJA curriculum for the first time in its entirety in Nevada that we are aware of. We have the presenter list almost completely solidified. There's a couple people that may be a little tentative, but we're in a good space for where we are. We had the first trainer or presenter meeting yesterday morning to answer any questions that they had regarding the materials, because it is an evidence-based program. So they do have standardized materials that they will be delivering. It is not scripted, thank goodness. So they can still kind of add their special sauce, and there's very detailed trainer notes that come with that. But it just, that can be really difficult, particularly when you may be used to presenting on specific things. Registration is currently open for our Tri-County region. Tri-County would be Humboldt, Lander, and Pershing. For those law enforcement agencies only, but on October 16th, we are going to be opening that out for any rural law enforcement agency, specifically in the other 3 counties served by the rural region, but really open for anybody else as well. I send out a save the date to my folks, just so they can have that on their calendar and start figuring out who they may want to send. We're capping registration at, I believe, 20 to 25. We're saying 20, so if we need to extend it to 25, we can. Any more than that is not appropriate for CIT, particularly since we do have a lot of role play in the standardized curriculum. Continue work on the trying to find and build the standardized curriculum. It should be built off of the one that we're piloting. And last but not least on that note, the COSSUP grant funding application by the Nevada Attorney General's office was submitted. We should be hearing back this month as to whether or not we got it or not. It hypothetically starts on October 1st. However, last time around, apparently they were notified at end of October and early November, and the funding wasn't released for 10 months. So fingers crossed we hear sooner and that things go a little bit faster than that. Still working on the life and social skills curriculum. Nailed it down to approximately 8 1-hour modules. And you've already heard a lot of my legislative work that I'm doing. However, I do want to get a virtual pre-legislature behavioral health summit going. And so I've talked to my counterparts about this. We have a planning meeting for October 7th, but really the purpose of this is to help prepare stakeholders in general for the legislative session. So this will be for policy boards, prevention coalitions, community members interested in advocacy, other nonprofits, legislators, and other stakeholders. So really broad, but just kind of helping provide some educational workshops for people who are interested in engaging in the legislative process. So what the process looks like, how they can interact with legislators or during different hearings, what that looks like. And then also have some discussions regarding behavioral health legislation that we are anticipating for the 2025 session. We cannot do any lobbying. However, we can have conversations and discuss, what we know is out there, what might be out there, what the potential impacts may or may not be. The Division of Public and Behavioral Health has started its work on the Bipartisan Safer Communities Act. They have hired Black Swan Consulting to conduct needs assessments. With this, so the Bipartisan Safer Communities Act really focuses, the meat of the act focuses on legislation and policy related to firearms. However, DPBH is focusing its work on ensuring that local emergency management plans include appropriate plans to handle behavioral health. That includes, crisis management, ensuring folks who have been on medication maintain access to any sort of medication that they have, providing follow-up care for persons who may be suffering from PTSD. And this would go for crisis responders as well as community members as well. So I've been working with Sidoni Naismith on that. I've had some great conversations with some of our local emergency managers. And the work group that Sidoni and her team have put together is finalizing a survey that will be sent out in the near future. I'm also helping Jerry and other folks on the Eureka County opioid needs assessment process and trying to figure out how we can help them out with that. Really nothing major other than that. We've done the transition between our 2 grant cycles. So we have the OD2A grant, which closes on that's September through August, and mental health block grant that's October through September. So we're now solidly in new grant years on both. As far as gaps and challenges, really looking at how we can engage our court staff across the region so that we can improve some of these processes. And then for opportunities, increased training for first responders and criminal justice personnel connected to behavioral health programming so that they can help kind of understand where they fit in this process. And then for other first responders other than law enforcement, there's not a lot of training given to EMS and fire regarding behavioral health crisis. And so what can we do to help support them and make sure that they have the tools that they need? Last but not least, we do need to reevaluate your board priorities and have those finalized by the start of legislative session. So that is it for me. My apologies for taking so long.
Questions for Valerie? Valerie, anything you need from the board at this time?
Not at this moment. I appreciate everybody's work and consideration. Every time I reach out to someone, you have been amazing and incredibly helpful. So we have a fantastic board, and it's a pleasure to serve you all.
Thank you. Okay, let's move on to item 8, which is public comment as we get ready to wrap this up. This is an opportunity for the public to speak. Again, dialing in the same numbers. I have to read this: 408-638-0968 or 669-900-6833. And when prompted, enter the passcode 292550. Please limit your comments to 3 minutes or less. And are there any folks that would like to speak at this time? You can use the raise hand feature down there on the bottom, and Valerie will call on you.
This is Vicky. I'm sorry, I don't know how to use the raise hand feature. I'm looking for it. Is it okay if I speak?
Speak up, Vicky. You're hard to hear there.
Oh, thank you. Hi, this is Vicky Erickson. I'm from the Board of Examiners for Social Workers for the state of Nevada. Can you hear me okay?
Yes.
Go ahead.
Thank you so much. I'm sorry, I don't know how to use the raise hand feature for some reason. I can't find it. So I wanted to jump in, and I wanted to thank Valerie for reaching out. And I don't know how you do it, Valerie, but you've covered so much stuff, and I appreciate all of your help. I specifically wanted to thank this board for addressing BDR 54-403 to include the Social Work Interstate Compact. I'm grateful for all the work you do. We're hopeful for this to go through, of course, to kind of bridge that workforce gap in the rural areas and allow for easier transition into behavioral health personnel to start working in the state of Nevada. I just wanted to thank you all for your work on that.
Thank you, Vicky.
Laura Osland has her hand raised.
Go ahead.
First, I'd like to thank you guys for your support and consideration of the letters. And I would also like to have the information from the person who is looking at providing the training, the transportation, the non-emergency medical transportation, if I could get more specific contact information regarding that, because as you know, it is a great concern for us in the rural frontier area where our community members are transported out and then we can't get them back, so, or can't get them back easily. And so I would be interested in getting the contact information and seeing how we as the coalitions can support that also.
Laura, I will do an email invite to Mark Funkhauser so that you're connected to him.
Thank you so much.
Valerie, I was gonna suggest that you could provide Mark's email contact now to the board members, because I think there's some other board members out in the rural areas that would be beneficial having that information and working with Mark.
Absolutely. So just so everyone is aware, his email is very simple. It's a lot easier than mine. It's Mark, M-A-R-K, at nrhp.org.
Okay. If anybody didn't catch that, you can certainly contact Valerie and she can connect you with Mark as they work through the process there. That's one that we'll be following pretty closely, because it's also, transportation's been one of our target points in our strategic plan going forward too. So it always comes up in our priorities. So appreciate that, Mark. Okay, any other public comment?
Joseph Filippi has his hand raised.
Go ahead.
Thank you, Chair, and appreciate the board giving me an opportunity to speak today. Can you all hear me okay?
Got you, Joe. Go ahead.
Okay. Perfect. So I serve as the Executive Director for Patient Protection Commission. Appreciate Valerie providing you all with an update on a couple of our BDRs that we are proposing this upcoming session. I think there was one out of the 3 BDRs that the commission is putting forward that was left off the list. So just wanted to make sure you had the whole picture. So additionally, BDR 38-450, it would increase provider reimbursement rates for physicians and APRNs by 5% through Medicaid, with an additional bump of 3% for services offered in rural areas of the state, and then also an additional 3% rate increase for providers who participate in value-based payment models. So just wanted to note that that also would impact rural providers. I know you all are supportive of any kind of access to care increase for your region. So just wanted to share that BDR as well, and appreciate the time today.
Thanks for that, Joe. We'll definitely Joseph will track that one also. Valerie will add that to her list, and because that has some great impact for not only the providers, but the small rural clinics and some of the hospitals with regards to that increase. So we'll track that one. Okay, other comment? Okay, hearing none. Valerie, you have any others?
I see no further.
Okay, we'll close the public comment, and next will be the adjournment. Reminder to the board and those on the call. Our next meeting will be November 1st at 1 p.m. It is already scheduled, so if you need information regarding that meeting in advance, please contact Valerie. She will include you in the listserv for the public that are on the call that would like to be notified of that. Any questions from the board before we adjourn? Or comments? Okay. With that, I will say that in the actual meeting time is under 1 hour that we have spent today, and I appreciate the board indulgence for sticking around while we were able to muster up the quorum, and then sticking around for the duration as we went through these topics. So any questions, please shoot them to Valerie or myself. We'll be here for you. So with that, we'll adjourn at 12:05, and thank you, everyone. Have a great weekend.
Thanks, guys.
Thank you, everyone.